Welcome back, everyone, to the deep dive. Today, we're going to be focusing on, well, kind of a concerning situation, really. It's come to light involving the veteran healthcare systems over in Columbus and Chillicothe, Ohio.
Right.
We're going to be taking a deep dive into a formal complaint. It was filed by Jessica Rickett on behalf of her husband, Stephen.
Yeah, and this complaint, it really outlines some very serious allegations of systemic issues.
Yeah.
It's not just like one isolated incident.
Right.
Mrs. Rickett, she uses some really strong terms. She's claiming malicious, even willful, deliberate, and intentional negligence, even malpractice and violation of patient rights and denial of care within these facilities, starting as far back as 2019.
Wow.
And it's continuing even up to the present, according to the documents we have here.
Okay, so to be clear, at the heart of this complaint, we're seeing the assertion that the VA has just been refusing to even test, diagnose, and treat basic service-connected disabilities.
Right.
And these include, from what we understand, conditions linked to toxic exposure, the ones that are listed under the PACT.
And to make matters even worse, there's this accusation that they've been deliberately concealing information in his imaging reports.
Yeah. And what I think is really striking about all of this is just the scope of the allegations. I mean, it's not just one or two errors. She's suggesting this pattern of negligence that's been going on.
Right.
And she believes very clearly that it's had a huge impact on her husband's.
6 years. Wow.
Yeah. And we have a bunch of different sources here, too. The formal complaint itself, some excerpts from his actual medical records, and then a bunch of other related documents that really lay out these claims.
That's a lot.
It is, yeah.
Yeah.
And so our goal today is to kind of understand, what are the main points? What are the core points of this complaint? And just really grasp how serious this is.
Yeah. Well, let's start with that big picture. So this alleged systemic negligence and denial of care. They say there's a widespread problem in both Columbus and Chillicothe VA systems.
Mm-hmm.
And they say it's been going on since 2019. And the complaint doesn't hold back. They say it's directly led to a decline in his health.
Exactly. And she really doesn't mince words when she talks about this. She says, this alleged negligence has resulted in all of these things. Multiple tumors, cancers, cysts, other medically treatable conditions, nerve damage, and just a big overall decline in his health in the past 6 years.
Wow.
And it's especially powerful when you add in that other part that the VA, they knew about, supposedly, some of his cancers, back in 2017, but didn't even report it.
And this is where it gets even wilder. They had to seek treatment outside the VA, on their own, just to even start to address some of these conditions. And according to the documents, many are still going untreated.
That's a huge red flag right there. I mean, the VA, they have this fundamental responsibility to provide timely and effective care, especially for service-connected conditions, especially anything linked to toxic exposure. And if they're having to go outside the system, it shows a serious breakdown in that responsibility. Yeah. And that really leads us to the next part of the complaint. It focuses on an alleged failure to review and act on his medical records. And this isn't just recent stuff. It goes all the way back to his time in the Marine Corps in 1991.
Right, and that's a really critical piece of the puzzle here,
Yeah.
It's not just recent stuff. It goes way back, and that suggests a pattern of potential oversight, or, as the complaint states, intentional concealment.
Yeah.
There's this one specific example they give, and it really stuck out to me. There's this adrenal tumor, and they even pinpointed it in the documents. It was found by the Columbus VAMC on August 25th, 2017, but they claimed that it wasn't reported to Stephen until February 14th, 2024. And that was only because it was accidentally revealed through this C&P exam report, which also said it had grown by August 10th, 2022.
So hold on. They allegedly knew about this tumor for, what is that, almost 7 years, but didn't tell him.
Didn't tell him, and it grew during that time, according to these documents.
That's so disturbing.
It really is. And then there's also this issue of a potential pituitary tumor.
Oh, right.
So this was seen on a brain MRI from December 15th, 2023, and there's another MRI from 2023, but it doesn't have a specific date. And the allegation here is that, again, the VA's own imaging reports, they don't mention this potential tumor at all. But then you have this outside hospital, and they were waiting for approval from the VA to do surgery for it. We even have the December 15th MRI image here.
Oh, wow.
And there's this area that's clearly highlighted, an area of concern.
Yeah.
And then there's this CT scan from later, March 4th, 25. And the report says no acute intracranial abnormality. But it doesn't actually rule out a pituitary tumor,
Yeah.
And the images from that scan, we don't even have them in the report.
Right.
So this really feeds into that whole thing that Mrs. Rickett calls imaging report fraud. Like the idea that they're leaving things out on purpose.
To hide the truth.
Yeah.
And it's so frustrating because, like when you look at all of this together, all these little pieces, it starts to look like a much bigger problem. It's not just an oversight anymore.
Exactly. It's a pattern. And the thing about these imaging reports, the way they were handled, it's really disturbing.
Okay, well, let's break down some of the specific examples then of what she's calling neglect. So in the complaint, it talks about chronic inflammation.
Right.
And it points to over 40 instances where his record says he denied having dyspepsia. But here's the thing. He has all these diagnoses of bronchitis, COPD, sleep apnea, all connected to his breathing.
So there's like a disconnect between what they're writing down and what he's actually experiencing.
Exactly. And then you have these vision problems. Like, apparently he's been experiencing temporary blindness since 2014, but the complaint says the VA hasn't done anything about it.
Oh.
That's like a decade of reported temporary blindness.
That's a long time.
Yeah. And then it mentions this TIA diagnosis, so a mini stroke, with, again, seemingly no follow-up care.
Right. And those are both really serious neurological events that, they need prompt attention.
Yeah. And then there's the recommendation for neck surgery. This was back in 2014 for cervical spinal stenosis. But the complaint says the VA just kept pushing it back, and it doesn't stop there. He had syncope, so fainting spells, for 17 years. And only then did the VA send him to a specialist, and that was only because he asked.
Yeah, that's a really long time to be living with something like that, especially if it could be dangerous.
Yeah, exactly. And speaking of things that could be dangerous, his spine problems sound extensive. The complaint uses really strong language. It says he was treated like a malingerer.
Oh, wow.
Like they thought he was faking it.
Yeah, and that's a pretty serious accusation,
Yeah, for sure.
Especially for healthcare providers, because it implies that they don't believe the patient.
And then you have this dementia diagnosis. He got it in Australia in 2021, but the complaint says the VA did nothing with it. No testing, no diagnosis, no treatment.
And that really speaks to this potential pattern of just dismissing diagnoses that aren't made within their own system.
Right. Okay, now this next part is it's very sensitive. It's about his children's birth defects and his spouse's miscarriages.
Oh, wow.
The complaint raises this possibility that it's linked to Agent Orange exposure in Okinawa back in 1991, which was just before the Gulf War. And they're accusing the VA of trying to hide these records. They specifically mentioned his son's Poland syndrome, which is a rare birth defect.
Right.
And the VA's explanation was that this could only happen if Stephen was a woman who served in Vietnam.
Wow.
But the complaint refutes that, saying he was exposed to Agent Orange in Okinawa.
Right, and that's where it gets really tricky because the VA is also claiming that Agent Orange was used in the Persian Gulf, right?
Right.
So was it related to the supplies from Okinawa? I mean, it's a huge question. And we actually have some information here about rainbow herbicides and approved Agent Orange claims that are specifically related to Okinawa.
Wow.
So there's definitely a history there of toxic exposure in that region.
It's a really complicated situation because, you're talking about potential effects across generations now.
Yeah, absolutely.
It's not just the veterans themselves.
Right.
It's their families, too.
And it makes you think about the long-term consequences.
Yeah. And to add to all of this, the Chillicothe VAMC allegedly refused to give him a neurology consult, all because they hadn't done the imaging themselves.
Wow.
Even though an outside hospital had already found the potential tumor.
So they're putting, bureaucratic hurdles in the way of his medical care.
Exactly. And then on top of that, they denied him physical and occupational therapy, saying that he looked young and healthy.
But he has documented paralysis, syncope, he's had falls.
Yeah. And the complaint lists other ailments, too?
So they're basing their decision on, a superficial assessment instead of his actual medical needs.
Yeah. And then you have this whole incident where he was labeled a dirty vet at the Sacramento VAMC back in 2014. This was because of a positive for barbiturates.
Oh, that's just heartbreaking.
Yeah, it's Devastating. Like, the impact of these errors
Oh.
within the VA system, they're so profound.
Yeah, and they have lasting consequences.
Yeah, they really do. And it's not just about the physical health either.
Like the other way.
It's their entire lives that are being affected.
Right.
And the whole back and forth between cancer and psoriasis is really concerning too. Like, apparently he was treated for pre-cancers going back to the 90s.
Oh.
But then in 2025, he gets this diagnosis of psoriatic psoriasis.
Mhm.
And when you look at the list of other conditions, he's got melanoma, basal cell carcinoma, the adrenal twicker, renal cysts, thyroid issues, pituitary abnormalities, and a lung granuloma.
It's a long list. And it makes you question the accuracy and consistency of the diagnoses he's been getting over time.
Yeah. Like, which one is it?
Right.
And even simple things like travel claims have been a problem. Like, they denied a travel claim for a 2-day installation of an adaptive device.
Wow.
And they delayed that service for 6 months.
So even when they are trying to provide care, it's like there's these constant hurdles.
Yeah. And all of this just adds so much stress, you know,
Absolutely.
and financial burden to veterans who are already dealing with so much.
Yeah. And the complaint also touches on caregiver support. Jessica was able to clear up his thrush very quickly, and she thinks it was caused by a medication the VA prescribed, but they're frustrated with the rules around caregiver support.
It's like there's this disconnect between the formal support and what families are actually doing.
Exactly. And it highlights how important that family support is.
Yeah. And lastly, under these specific instances, the complaint talks about an encounter with a Dr. Fulop at the VAMC Columbus. This doctor diagnosed him as a malingerer, again saying that he was faking it,
Oh, no.
and then allegedly said to him, "You should have been dead by now."
Oh, wow.
I mean, that's a shocking thing to hear from a doctor.
It really is. And we actually have a document here that lists Fulop James Peter as the provider for a somatoform disorder diagnosis, which was added in December 2019.
What does that mean?
So it basically involves physical symptoms that don't have a clear medical cause. But considering all of the other physical ailments that he's reported, it just makes this whole situation even more complex.
Yeah. Okay, so let's move on to the specific concerns that are raised in the complaint. So the first one is a big one: failure to maintain accurate and accessible medical records.
Right.
So this includes missing records, imaging that's been uploaded wrong, so it's basically unusable, and then blocked access to online records since 2022.
That's a lot of missing information.
Yeah. And it also talks about problems with FOIA requests. Like, he got discs with missing records, and one time he even got an empty envelope.
Wow.
We even have a picture of what looks like a tampered envelope.
And, I mean, the integrity of medical records, that's fundamental to providing good health care.
Absolutely.
So this is really serious.
Yeah. And then the next concern is about a retaliation and patient abandonment. They're saying his care was stopped after they started raising concerns.
Wow.
And the complaint says a VA employee confirmed that he was red flagged or blackballed by the VA.
That's, I mean, if true, that's a huge ethical and professional breach.
Yeah, it's really disturbing.
It really is.
And it suggests, like, a system that punishes people for speaking up.
Exactly. And the next concern is delayed and denied specialist consults and referrals.
Right, including care outside the VA.
Which is especially concerning because that could have potentially been a lot faster.
Yeah. And this could lead to, like, illnesses getting worse and missed opportunities for early treatment?
Yeah, absolutely. And then there's this really striking statement from the VA.
Oh, right.
It says, no tests, no diagnosis, and no treatment equals VA veterans have no issues.
Wow.
So according to the complaint, this is like their attitude. They don't care about outside diagnoses unless they have their own test results to support it.
So they're just dismissing anything that happens outside their system.
Yeah, potentially. I mean, while they should verify diagnoses, this just seems like they don't even care about veterans' concerns if they come from outside the VA.
Right. And then Mrs. Rickett, she lists all these VHA directives that she claims the VA has violated, and it's a lot.
Wow.
It covers communication, consults, patient advocacy, managing health information, disease prevention, so much more.
It's like they're not following their own rules.
Exactly. And these rules are there to ensure quality care and protect veterans' rights.
So this suggests a systemic failure.
Yeah. And the conclusion of the complaint is very strong. They accuse the VA of using the federal budget to target veterans with service-connected illnesses,
Wow.
particularly those connected to Agent Orange and the Gulf War.
Oh, wow.
And they say the VA created rules to deny them benefits.
That's a huge accusation.
Yeah. And it goes even further. The complaint claims that these practices lead to shorter lifespans and contribute to early deaths and suicides among veterans.
It's like they're saying the system is working against them.
Exactly. And then there's a specific inquiry about Agent Orange in the Gulf War. He wants details about its origin, shipment, storage, deployment, and he connects it back to his own exposure in Okinawa.
So he's not letting this go.
No. And it highlights these unanswered questions about toxic exposure.
Yeah.
Like, what are the long-term consequences?
For the veterans and their families.
Right. And then there's this brief mention of the Patriot Cabin community.
Oh.
It was an initiative they started to help other veterans, but they say the VA's actions against Stephen hindered their efforts.
So it wasn't just about his health. It was also affecting their ability to help others.
Exactly. Okay, so let's circle back to that adrenal tumor.
Mm-hmm.
We have a record from August 25th, 2017, and it clearly shows that adenoma. And he says they knew about it, but didn't report it, didn't tell him, didn't do anything.
Right.
He thinks a lot of his problems are linked to his adrenals, thyroid, pituitary, kidneys, and lungs.
So he sees this as like the root of a lot of his issues.
Yeah, and then the 2024 QTC contract examination addendum, it's interesting. It says service connection is established, but it's non-compensable.
Because it's not causing enough problems according to their evaluation.
But the 2017 records from Columbus linked it to toxic exposure?
So it's like they're acknowledging it but not taking responsibility.
Exactly. And that discrepancy is a big deal.
It is.
Yeah.
It really highlights the complexity of these disability evaluations.
Yeah. Okay, now the pituitary tumor. We have that MRI from December 15th, 2023, and you can see the potential tumor. He says an outside hospital wants to do surgery, but the VA hasn't even acknowledged it.
Right.
And then we have that CT scan from March 4th, 2025, that says there's no abnormality.
But it doesn't rule out the tumor either.
And there are no images with that report. So it all feeds into that suspicion that they're not being truthful.
Absolutely. Especially when you consider that outside medical opinion.
Yeah, it just raises more questions.
It does. And finally, let's touch on the Gulf War illness using what we have from the Jesse Stephen Cabin PDF.
Okay.
So Gulf War veterans and their families, they've faced a lot of illnesses, and there are concerns about birth defects in their children.
Right.
And while Agent Orange is usually associated with Vietnam, this highlights the potential for exposure in other places like Okinawa. And it happened before they even served in the Gulf. There are a lot of worries about underreporting and denial of service connection.
It could be affecting so many people.
It could. And we know from our sources that the VA has acknowledged toxic exposure issues in Okinawa in the past.
So it's not like it's a new problem.
No, not at all.
It's really a lot to take in, isn't it?
It is. It's this whole web of allegations, discrepancies, and bureaucratic hurdles.
And what Jessica Rickett is claiming, it paints a very concerning picture of their experience with the VA.
It really does. So to our listeners, you've heard about these serious allegations, and they're backed up by a lot of documents.
Yeah, our goal today was to give you a good summary of everything directly from those sources. All right, so, we've been going through a lot of this stuff, and you've given us a whole set of documents, really. I mean, some pretty heavy stuff in terms of your experience with the VA. And I got to say, some of it is, really concerning to see.
Yeah, no kidding.
Mhm.
It is a lot. And I think that's part of why we're doing this. You've got the VA statements and then, medical records and even imaging in there, CT scans, MRIs, a lot of correspondence back and forth.
Yeah.
And it can feel overwhelming, right?
Oh, absolutely. It's like, where do you even begin?
Right, exactly. And I think that's our goal here, is to kind of cut through that and really try to focus in on what matters.
Yeah. And I mean, there are some things that just really jump out at you right away.
Oh, for sure.
Like that statement, you should have been dead by now. I mean,
Oh my gosh.
where do we even start with that?
I know, right? Well, I mean, first of all, just seeing that in an official document is shocking. Just the language itself.
It's unbelievable.
It is. But then beyond that, when you really think about it, it almost suggests like a fundamental disconnect, right? Like the VA is saying this about your health, but you're clearly here, you're alive, you're talking to us.
Right. And it's not just about, living alive. It's like this whole disregard for what you've actually been through.
Yeah. And, it makes you wonder if maybe the system is just not equipped to deal with these complex situations or long-term conditions.
Yeah.
Maybe it's leading to these kind of like premature conclusions about people's prognosis.
It's a scary thought.
It is, and it's something to really consider.
So let's move on to something a little less heavy, but still really important, your service connection for your adrenal tumor. And we have the QTC contract examination addendum here, dated February 14, 2024. And then the decision document itself, the Jesse Stephen 2024 decision.pdf that really lays this out.
Right. And these documents show that your adrenal tumor is directly linked to your military service. And they cite regulations 38 CFR 3.303 and 38 CFR 3.304. And those are key because they establish the principle that if your service caused or worsened a condition, then it's considered service-connected.
So even if something develops later on, if it can be traced back to your time in service, then...
That's right. It's covered.
So then we see a non-compensable evaluation assigned back in August 2022, effective from the date of a change in law.
Uh-huh.
And I'm going to throw out another regulation here, 38 CFR 3.114.
Okay.
Can you help us understand what non-compensable means in this case and why this law change was so important?
Sure. So non-compensable in this case means that the VA acknowledges the service connection. They agree that the tumor is related to your service, but at the time it wasn't considered disabling enough to warrant financial compensation.
Okay, so they recognize it's there, but it's not affecting you enough to,
Exactly.
impact your daily life.
Right. And that's where the 38 CFR 3.114 comes in, because this regulation basically allows the VA to grant a claim based on a change in the law, even if you didn't meet all the criteria before that change happened.
So, the rules changed in your favor, essentially.
Exactly. So the law changed, and now your tumor is considered service-connected, even though it might not have been under the old rules.
That's a good thing, right?
It was definitely a good thing.
But it's also a little frustrating because it makes you wonder, what if that law hadn't changed,
Oh, for sure. It raises a lot of questions about how these decisions are made.
Absolutely. So moving on, we see that the Columbus VA treatment records from August 25, 2017 note an 8-millimeter lipid-laden right adrenal adenoma.
Okay.
And then a September 28, 2022 CT scan shows a 9-millimeter right adrenal tumor.
Right.
So that's a 5-year gap between those two images.
Yeah, and that is noteworthy. And the examiner in the 2024 addendum even connects this tumor to potential toxic exposure during your service in Asia, and that falls under 38 USC 1168 and 38 CFR 3.303.
And it's currently benign with a recommendation for just monitoring, right?
That's right, just watchful waiting for now.
Okay, so even with the service connection and the documented growth of the tumor, the non-compensable rating stays in place because based on regulations like 38 CFR 4.31 and 4.119, a disability rating that would lead to compensation is only assigned if it's impacting endocrine functions, right?
Yeah, that's right. It's really about how the condition is actually affecting your health and your daily life right now.
So it's not just about having the condition, it's about how it's impacting you.
Exactly. And 38 CFR 4.20 gets even more specific. It says that disability evaluations are based on the impact on the bodily functions, the location of the condition, and how severe the symptoms are.
So they're looking at the whole picture, not just, is it there or not?
Right. And that makes sense in a way, but you can also see how this would be frustrating for a veteran.
Oh, absolutely. If you know something is there and your service caused it, but it's not considered disabling enough for compensation, it's like...
Right. And what about down the line? What if it does start to cause problems then?
Exactly. It's like non-compensable now doesn't mean never a problem.
Exactly. And I think that's an important thing to remember.
Yeah. So let's move on to a much more sensitive topic, the accusation of malingering.
Okay.
And this document, Jesse Stephen 2019 malingering.pdf, shows that a problem of somatoform disorder SCT 31297008 was entered into your records on December 17, 2019 by a provider at the Chalmers P. Wiley VA Outpatient Clinic.
Okay.
With the status of active. So can you explain to us and to our listeners what a somatoform disorder is and why this is connected to accusations of malingering?
Sure. So somatoform disorder, as it was classified, then it's a condition where someone experiences physical symptoms, and these symptoms cause real distress and disrupt their life. They're not making it up, but doctors can't find a clear medical explanation for them, or the symptoms seem out of proportion to what they're finding.
So it's like a real thing, but they can't figure out why.
Right. And that's where the problems come in, because historically, and even sometimes now, this kind of diagnosis has been interpreted as meaning the symptoms are all in your head, basically.
Oh, wow.
Which is so wrong. And it can lead to these accusations of malingering, where people think you're faking it for attention or to get benefits or something.
That's awful.
It is. And it's really damaging because it completely ignores the person's real suffering.
And it's especially concerning in this case because we have all these other documents showing very real physical issues.
Exactly. It's like they're seeing this one diagnosis and ignoring everything else.
So it just goes to show you can't make assumptions without looking at the whole picture.
Absolutely. And I think this really highlights the need for a more holistic approach to veteran health care.
Yeah.
You can't just dismiss someone's symptoms because you can't find an obvious cause right away, especially for veterans who might have been exposed to toxins or have other service-related conditions.
Right, and it's like this label can just overshadow everything else.
Exactly. It becomes the only thing they see.
So let's shift gears now and look at what appear to be repeated mistakes and potential fraud in your medical records.
So,
This document, the Jesse Stephen Final.pdf, has a very strong statement claiming that the Columbus OHVAMC found an adrenal tumor back in August 2017, but you weren't actually told about it until February 14, 2024.
wow.
That's almost 7 years, and a CMP exam in August 2022 even noted the tumor too. So this delay is just mind-boggling.
That is really concerning. I mean, to not report a significant medical finding like that, especially when it's service-connected, raises so many questions about what's going on internally.
That's like a breakdown in communication.
It is. And
Yeah.
that kind of delay can have huge consequences for a patient. It affects their understanding of their own health, their ability to make decisions about their care, and potentially even delays treatment.
And it's not just the delay, it's also the problems you've had getting your own medical records.
Yeah.
You've documented issues with FOIA requests.
Yeah.
Getting only one disc when there should have been 3, and then another request coming and an unsealed empty envelope.
That's not just a mistake.
Yeah.
That's
Weird.
it's really concerning. And it makes you wonder about the integrity of the whole record retrieval process.
Like, are they trying to hide something?
It's a possibility. And, when people can't access their own medical history, it prevents them from being active participants in their own care.
Yeah, and it just adds another layer of mistrust, doesn't it?
Absolutely. It erodes the whole foundation of the doctor-patient relationship.
Okay, so then we get into the brain imaging. A brain MRI from December 15th, 2023. The Stephen Rickett Brain MRI 2022-2023.pdf asks, straight up, is this a pituitary gland tumor?
Oh, wow.
I mean, that's a big deal, right?
It is a huge deal. And a question like that on an official report needs to be investigated thoroughly, and there needs to be clear follow-up. You have to determine if it's actually a tumor and what it means for the patient.
So that should have been a red flag right there.
Absolutely. It should have triggered a whole chain of events to figure out what was going on.
But then we see this CT head whoa, CONT, performed on March 4, 2025.
Okay.
That's the VA CT of Brain 2025 fraud, again, .pdf.
Right.
And the reason given for the scan was a history of occipital TVOs and migraines.
Okay, so tell me more about these TVOs. What are they?
So the clinical history mentions a previous brain MRI for possible TIAs around 2023, no recent carotid ultrasound, and no neurology follow-up since before 2020.
Okay.
It says you were using Tylenol and turmeric for migraines.
Okay.
And the occipital TVOs are described as like intermittent blacking out episodes in both eyes,
Okay.
which they initially thought were ocular migraines.
All right, so these TVOs sound serious.
They do, and we also see a 2016 carotid ultrasound showing less than 50% stenosis and an echocardiogram showing septal motion consistent with a conduction abnormality.
So there's definitely some history of investigation into potential neurological issues, but it also seems like there are these gaps in care, especially with the neurology follow-up. And that information about the carotid ultrasound is important because it gives us some context about possible vascular problems.
And to clarify, an MRI gives a really detailed view of soft tissues,
Right.
while a CT scan is better for seeing dense structures like bone and ruling out major acute problems.
Exactly. So they both have their strengths and weaknesses depending on what you're looking for.
And here's the thing, the impression from the 2025 CT scan says no acute intracranial abnormality is identified.
Okay.
But that really contrasts with the 2023 MRI that specifically asked about a pituitary tumor.
Yeah, I see what you mean.
So even though a CT scan is useful, it's not always as good as an MRI for finding certain types of soft tissue abnormalities, like a small pituitary tumor.
Right. A CT might miss something that an MRI would pick up.
Exactly. And given how serious that MRI question was, there should have been some kind of follow-up to address it specifically.
Absolutely. And the fact that the CT scan didn't show any acute problems doesn't mean the earlier finding was wrong.
Right. It's like they're just ignoring it.
And that's the problem. There's this potential breakdown in communication between different imaging modalities and different healthcare providers.
So we have this huge delay in reporting the adrenal tumor,
Right.
the difficulties getting your medical records, these conflicting and unresolved findings from the brain imaging, and then that early diagnosis of a somatoform disorder.
It's a lot.
It is. So what does this all tell us about the accuracy and the integrity of your medical records and the communication within the VA system?
Well, honestly, when you look at all of this together, it raises serious concerns.
Yeah.
The delayed reporting, The problems with accessing records, the lack of follow-up on that MRI, finding it all points to potential systemic weaknesses in record-keeping, communication, and coordination of care within the VA.
So it's not just a one-time thing. It seems like there's a pattern here.
Exactly. And then when you add in that somatoform disorder diagnosis, it becomes even more complex because now the reliability and completeness of your whole medical history is in question.
So it's like you can't even be sure what's accurate and what's not.
Right. And it's understandable why you would feel like your health concerns aren't being taken seriously.
So this has been a lot to take in, and I'm sure it's left us, and more importantly you, with a lot of questions.
For sure.
So as we wrap up this deep dive, here's the thought I want to leave you with. Given all of this, the statement, the diagnoses, the inconsistencies in your records, what do you think is the most crucial area for you to focus on now as you move forward in your healthcare journey?
It's a good question.
What's the next step for you? What do you need to figure out first?
That's something to really think about.
Yeah, and maybe by reflecting on what we've talked about today, it can help you figure out that next step.
I hope so.
I do too.
This has been really helpful to go through all of this.
I'm glad, and I hope it's been helpful for you listening as well.
And remember, you're not alone in this.
There are resources out there and people who understand what you're going through.
So don't give up. Keep fighting for your health.
And keep asking questions.
That's right. Knowledge is power. And now we want to leave you with something to think about. What kind of problems in the VA system could lead to these allegations? What challenges do veterans face when they're trying to get the care they need?
Because, everyone who serves our country deserves thorough, transparent, and patient-centered care.
Absolutely. We encourage you to consider all of this and maybe even look into it further on your own. Thank you for joining us for this deep dive.
And we'll see you next time.